This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any aspect of problems that you may be having. Give us a call at 888-630-9625. That's 888-630-9625. Love to talk to you. If you've had a problem and you've searched and applied and tried and come up with the same old, nothing that works, well, here's an opportunity. Let's figure it out. Let's see what we can do to make a difference in your health permanently. We have a topic, and it's an interesting topic, given a couple different things, but one more importantly, it's cold outside, right? It's really ugly cold. I mean, this is the stuff that I brought down from, western New York State when I did the movement down here back in, 1985. But we're going to talk about allergies, springtime allergies, the stuff that makes you feel miserable and stuffs up your head and makes you run, but more importantly, makes your intestinal tract kind of a bad place for anything to survive in, and muscle ache, and actually the symptom process goes on. But to do that and to help me discuss it intimately and very specifically, Dr. Matt Adams.
Hello. Happy spring.
Happy spring. You and I had a little bit of a challenge getting here to the station today. By the way, any of you that are out and about and on River Road up in the Bethesda area, be very careful. There's a couple cars that spun out, and please have the road blocked off and diverting through the residential areas. So be very, very careful as you're traveling about today. The roads are slick. They are slippery.
Yes, they are.
And both of us, we just it was one of those days. But anyway, be careful. Having said that, we're going to talk to you about allergies. This Wednesday evening, the 18th of February, Dr. Matt Adams is going to be doing a presentation on the topic we're talking about, springtime allergies, and how they affect you, the problems that come about. More importantly, what you can do about it, and so you don't have to continue the process of suffering like you are. It's not okay. You don't have to do this, and there's a whole matrix of what happens that sets you up for exposure with these things, and this is your opportunity to really make a difference in that. Dr. Matt, let's get into the basis of this. There's allergies and there's allergies, and with springtime allergies, we talk about different types of antibody responses, IgA, IgE, IgM, IgG, and so forth, and the list goes on. And IgA, which we often call the first line of defense.
Yes.
That's mucous membrane protection against anything that's incoming. And most people, and if you check the literature, they talk about foods being, the one that really responds. But it's not only foods, it's environment, it's chemicals, it's all kinds of things, anything that comes through the mucous membranes.
Yeah, all these set us up for having these major reactions with seasonal allergies. You like you said, you've got different types of antibodies. These are things that attack infections, attack things in your body that are not supposed to be there, and some of them are there to attack them really fast as soon as they get there. You get that when people have like a peanut allergy or something like that, and they just flare up like crazy. And you get some that come and start attacking later. You may have issues up to 2 days later. The thing about this with seasonal allergies, though, is if these are always under attacking things, then the problem is your immune system gets too sensitive, and so when you start getting exposed to all these seasonal things in the air, where normally you would be okay, now your body just reacts like crazy, and that's when you start getting the watery eyes and the stuffy nose and all that stuff.
And we're talking about 25 to 30% of the population that reacts to this type of insult, if you will. It's a huge number.
Yeah, out here it's crazy. And last year was even crazier because we had such a long winter, and it seemed like all the pollen came off at once. And we had all kinds of people in the office, probably higher than the 25 to 30%. But yeah, Northern Virginia, I can probably even more. You see your car out in the springtime, it's yellow.
Well, you live in a swamp. That's why they call Washington foggy bottom. It's the mold, it's the fungus. If you've never had a mold, fungus, yeast infection, you will once you live here long enough.
Yeah.
I mean, it's constant. The insult is really over the top. So let's walk our way through it a little bit. I mean, we do have many more allergic responses, and people are on all kinds, as I call it, nose dope, to shrink their membranes and stop the irritation to, the mucous linings and so forth, which actually rebounds and makes it much worse than it should be. And, people go to suppress the symptoms and their corticosteroids and their inhalants, and you talk about they can't breathe and they're stuffed up, but more importantly they feel horrible. The headaches, their stomach starts cramping, they get irritable bowel in some situations, even heart palpitations.
Yeah.
So talk us through what really happens. Let's talk about the why. Why are some people it appears to be more susceptible than other people to the springtime phenomena?
Well, it depends on how your immune system is coming up into the springtime. If somebody as their immune system is more sensitive, I mean, part of it could be, some genetic factors from when they were born. If your parents had allergies, you're more prone to have them from statistics. And then if over time you have done things to your body, the things you've eaten, which can compromise the intestinal tract, which stimulates the immune system, or maybe you're under a lot of stress, all these things can cause the immune system to not work as well and become too sensitive. And so that's why certain individuals can become more sensitive. But that also means that we know that there are ways to decrease the sensitivity.
Well, let's talk about the trigger, because you're starting to touch upon the structural biochemical stress patterns that affect this. And, we get to our old friends called the adrenal glands, the fight-flight system, if you will.
Yep, those guys.
And, they put out our steroids. They help defend us against this stuff. And really, the adrenal glands are the prime drivers in setting the stage and making sure the IgA response is strong enough to defend you from this incoming stuff.
Yeah, they also make cortisol your stress hormone, which it can be like an antihistamine as well. So you'd think your adrenal glands would be a lot bigger. Your adrenal glands are really small.
Well, compared to everything else.
I
yes.
know.
But they were 1/3 the size of the kidney at birth.
Yeah.
And then they shrink.
I think that they're made for a time when we weren't so stressed out living in these areas. Because they have a lot to do, and so they get worn out. We have so many stressors out there that are causing them to be so focused everywhere else that when this bombardment of pollen hits us, they don't have the ability to sometimes put the amount of effort and focus to support the pollen and the dander and all the other stuff floating through the air whenever the springtime kicks in.
So you start with that predisposition. Let's go to that, genetic, well, my mother, my father, and everybody else in my family had the problem.
Yeah.
And let's set it aside from environmental stuff where everybody grew up in the same area, so they're being bombarded by the same thing, they're eating the same way, so we have that presupposition, that predisposition, but actually genetic pass-through. So now we got a genetic pass-through which says that we have a weakness. And ladies, I'm sorry, this is another one that I have to finger wag at you, because just like mitochondria, the strength or weakness of the underlying genetic constitution, the adrenal system, seems to come from mom. And that's one of those things that that we see often. So if mom has a weak system, then because of she's going through the pregnancy and so forth, but we know that linkage is there. The mitochondrial patterns that have to do with a lot of these little energy packs within each system is transferred through from mom. And even the Chinese will tell you that the constitution, the basic qi, the shen, the spirit of the person comes from mom as well.
So you're saying the mom needs to be trying to be healthy or be healthy.
Mom needs to be super healthy
whenever they're forming a child. Not
only that, when they're thinking about it, and dad as well. I mean, it comes from both. But mom's the nurturing partner in this phenomena. So anyway, let's talk about that IgA response.
Right.
And that because those are the easy ones really to take care of. And what happens is that in traditional medicine, that's this area that we suppress the most, because we're going to shrink all these membranes up so they don't react. We're going to shrink things so we don't drool on ourselves and we don't have discharge and so forth. Here's a question that's asked a lot. What's the difference? How can you tell the difference between somebody who has an allergy reaction and their nose is draining and they're coughing and sneezing and so forth, and someone who has a viral pattern?
Someone who has a viral pattern or someone who has that. So, I mean, a lot of times you're looking at if they have like a fever, if they're getting hot. I mean, that's your body's a natural reaction to kill something inside. So you want to see that, first of all. Also, a lot of times with the histamines and those things, like you're going to have, I think you're going to have more like runny eyes and more sneezing attacks. I think you're going to get more of a runny nose and not as much. Like if you have a viral or bacteria, you're going to get more discoloration to the mucus in there.
Well, particularly if it's bacteria, you're absolutely right. And those distinguishing pieces are, it's a very difficult thing. We, in our practice, will look at different patterns, as you know, through neuromuscle function testing, and that can determine, we check different nutrients, and there's certain things that allergens will react to and certain things that won't. But the thing of it is with an allergy reaction, you're going to look at primary systems, and you do this all the time, and I know that's what you're going to bring out this Wednesday evening of the distinguishing pieces, and I didn't want to let the cat out of the bag too soon. Let's talk about, you have a fever, you don't have a fever. Most people, obviously, as you said, have a fever if they have a cold or if they have a bacterial infection. Not necessarily so in an allergy reaction. But here's the problem. It does set up the stage for the next step. And if you have an allergy reaction, your immune system is low, you can go very easily into an infectious process.
Oh, yeah, that happens all the time. What starts with allergies ends up becoming a sinus infection. And a lot of times I also find that what started with a small infection in the sinuses actually goes towards becoming an allergy. A lot of times these allergies, you've got an underlying yeast or fungal infection, maybe a small amount in your body, that's just kind of sitting there harboring, but it's enough to make your body a little hypersensitive. And because of that, whenever you get the insult of the pollen, it kicks in. Now everything's super sensitive. It kicks the histamine response, and you start getting all this eye watering, all this stuff that starts happening, mucus builds up. And then from there, your immune system kind of drops down a little bit, and that sets the stage for a bigger infection. So they're working with each other. We call these vicious cycles.
Yeah,
is what we call them.
It's ugly. I mean, even you get people that come in, and we see it all the time, that they go to their doc, and it's a straight-up allergic response. And we're going to talk about some of the testing when we come back, what's effective, what isn't. But here's the situation, is that somebody's put on a steroid, or they're put on an antibiotic, or a combination of those things, which blows my mind. I can never figure out why they do things like that. And they're actually setting up the stage for that vicious cycle that you just talked about, because that antibiotic and the steroid, they do a great job of destroying that underlying tissue, that protective membrane that should be there to act as a barrier to this incoming stuff.
Yeah, it's immune suppression. I mean, that's what they're going for. They're going for how we make the symptoms go away. And it works initially, but it's immune suppression. So if your immune system suppressed, I mean, what's going to happen?
Well, it only works as long as you're on the drug.
Well, yeah.
And then pretty soon the drug doesn't work anymore.
And then you have to go get some more.
Yeah, then you upscale to something that's much stronger. Then the steroids get more, then inhalers, and you're on all kinds of stuff repetitively just to keep it under control. And you'll go. I see patients coming in. They're on these prescriptions of take it when's necessary. Like, okay, it's necessary all the time. Got to take a break. We're coming up to that time. That we have to acknowledge people who bring you Dr. Tom Roselle Live. We're going to come back. We're going to talk a little bit about allergy testing and why some of these things that they're doing they're not effective and they have a huge false positive, false negative rate. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, we are in studio. It's cold outside, my friends. Give us a call at 888-630-9625. That's 888-630-9625. Love to talk to you. We're talking about springtime allergies. Yes, it's cold outside, but it is the middle of February already. And guess what happens? It's March, and around here, if, the weatherman is kind, we'll start seeing the pollens and the mold and the fungus and all those things start spurring up, and then you're in the middle of it. And once you like to figure out how to fix it before you get to that place, well, there is a way. And this Wednesday evening, Dr. Matt Adams is going to be your presenter and your host at the Roselle Center for Healing. The program is Springtime Allergies. And if you'd like to attend, all you have to do is call us at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to be there, and we just need a reservation. There's no cost. It's our gift to you. It's our gift to the community. And we have only so much room. And after that, we've got to either reschedule for a whole lot of you, or we have to say, I'm sorry, you can't attend, and you're going to have to wait till next year when we do this program.
And we don't want to do that.
And we don't want to do that. So, Dr. Matt Adams, my guest in studio, your host this Wednesday evening, 888-630-9625. That's how you find us here. Dr. Matt, let's talk a little bit more about the reaction that we get with these things, for everything from runny nose to even cardiac trepidation, a little rapid heart rate and muscle soreness and ache and intestinal trouble, and you can't think, and your head's all plugged up, and you got headaches, and the list is really formidable. It's quite interesting. Itching, skin rashes and itching and so forth. I have a patient who swells up like a balloon, every time that springtime comes around, and then we have to treat them. And so let's talk about traditional testing, and then later on in the program we'll talk about our kind of testing, which is really more accurate, because when we test we can actually desensitize. But this is truly a structural, chemical, emotional pathway. So, traditionally you go to the doc, and what they do is they say, okay, let's do an allergy test, and they do something called a RAS test, which is a skin triggering test.
They're gonna prick your skin with a whole bunch of different types of foods or allergens, pollens, dust, things like that, and just see what your skin does.
And the effectiveness as well?
Usually the effect, just about 40%, I'd say 40% accuracy on there. It's not very high, to be honest with you. I don't know how many times I've seen people come in and they're like, yeah, I did that RAS test and I'm allergic to everything. Or I did it and I wasn't allergic to anything. The thing is, the idea makes sense. You put something in the body and see how it reacts and see if you have an allergy. The problem is that most of your immune system is there to pick things up in the mucous membranes that we talked about, like in your mouth, in your throat, in your nose. That's when you're going to breathe things in. Whenever you get something directly past the skin into the bloodstream, usually your body's like, whoa, wait a minute, that's not supposed to be here, and it's going to respond. And that's why I don't think that's the most effective test whenever you're looking at allergies.
It always bothers me that we have all these reactions, and we live in an area where we have mold and dust and trees and grass and so forth, and all of a sudden we have a huge piece, as we said, over 30% of the population that has some sort of reaction to it. It's like we're a society that's weakening, that's going down the tubes. And it's like, really? Why do we have the problem? I don't get it. John, thank you for calling. How can I help you?
Yeah, I suffered with allergies my entire life. I'm 48 years old. Off the scale, on a scale of 1 to 10, it couldn't even been registered. And I just wanted to make a comment that about 20 years ago, an elderly gentleman saw me suffering and just told me that to take some local honey, an entire jar, until it was gone.
And it worked, didn't it?
Well, at that point, would have done anything. I was eating handfuls of antihistamines out of the boxes. It didn't matter what they were at that point, every 3 to 4 hours just to try to function. And what I noticed was the following year and every year for the past 20, 25 years, I have been totally cured of it.
Yeah, and the reason for that, John, is that because you're being exposed, you're actually being inoculated slowly to the environmental pollens, and it has to be local honey. It can't be something from California. It can't be someplace from Florida and so forth. It has to be local. There's another way, John, that works as well. Is what you do is you get the bee pollen, and you start usually this time of the year or even before, but you can't take a whole bunch of it because it can cause the same reaction as the environmental pollens do, and you would go one sometimes one little pellet at a time, building up over a period of months until you're taking a teaspoon once or twice a day, and it really makes a huge difference. John, I appreciate your phone call, but that's what we normally see.
Yeah, I've used that with my patients. That's a perfect example, and I'm glad John brought that up. That's kind of what's going on, what they're trying to do with the shots that they get with allergies, but this is a natural way to do it. Get your body exposed a little bit at a time. Let the immune system build up on its own.
And there's other ways of fixing it as well, and we're going to talk about that. And this Wednesday evening, Dr. Matt Adams is going to be your host at the Roselle Center for Healing, talking about springtime allergies, but more importantly, how to fix them, what you can do about them. We're going to talk a little bit more of the causes when we come back after the break. We're coming up to that time when we have to pay attention and say thank you to those who sponsor this program.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Neck and Shoulder Pain with Dr. Leonard Poe on Wednesday, March 4th at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Love to take your phone calls. 888-630-9625. 888-630-9625. It's cold outside, but we're talking about springtime allergies. In studio, Dr. Matthew Adams, your host, your presenter, this Wednesday evening. And he's going to be talking about springtime allergies and what you can do about it and how you can fix them. And you don't have to go through the slings and arrows of the sniffles and all the nonsense that many of you have been suffering with for years and years and years. I want to talk a little bit about the differences in testing at this point and IgE, IgA responses. And we've been talking a little bit about IgA, which is your mucus defense mechanism, and that's your first line of protection. And that's, if it's all beat up, now goes to inside the body. And some of you, if you smell something, you don't even have to get it near you. You just have to have the odor. You respond, you plug up, you feel miserable. Some of you have to, actually ingest it 2-3 times, which is a delayed response pattern. And, some of you, but guess what? You go to the doctors and they put all these pinpricks in your skin. And that's a skin titrate testing. And it's your skin reaction to the environment. It's not your environmental inside reaction. And then they do something I'll call a RAS test. And the RAS test is somewhat different than the skin test. And it's a blood test to determine different allergic reactions and so forth. It's a little bit more costly, so your doctor doesn't like to do that because they can't get permission from your insurance company to pay for it. So they do the skin testing, which is about 40% inaccurate when it comes to false positives and false negatives. But we have this RAS test, and that's an IgE response, which is an immediate response, and it's a little different than something that we'll mention called the ELISA LRA response, and we'll talk about that next. So, Dr. Matt, I set the stage for you.
You set the stage for me.
Let's get your feet wet here, boy.
Yeah.
Let's talk about this stuff.
So your IgE, that is when you think of if someone like my nephew who eats peanuts goes to the hospital or needs an EpiPen. That's your reaction taking place there. That's whenever you walk outside and boom, everything just kicks in and you can't see, you can't breathe, all these things. That's where your IgE, it's immediate, it's fast. So, it's there for a purpose, but it shouldn't be there happening when we have small amounts. So this test is testing for that. The thing about it, though, is, one, there's multiple different types of antibodies for different areas. Like you've already mentioned this one and that one, and then there's IgG, which is a slow reaction. So you're missing a lot of those. Two, your immune system is constantly changing. So I've had patients get this blood test done, or get the pinprick test done, or get both, and one, they're both different, or two, they get blood tests done at 2 different times. Even within a month, I had a patient come in, and they had 2 different outcomes. And so they're like, well, I'm confused. Why is this so different? Well, your body's changing, immune system's changing, your reactions change depending on how your system is working. So that's why you got to get to the bottom of it. Why is your immune system working the way it is? Why is it struggling?
Yeah, there's this thing called cross-reactivity as well, crossover reactivity. And you may be allergic to something because you've been exposed to something similar to it just prior to the test. But next time you take the test, you haven't been exposed to the other piece, so you don't have the build-up response pattern, so it may not show.
Yeah.
So when you're talking about any kind of testing, it has to be consistent under the same conditions, under the same immunological response patterns that the first test, the second test, the third test were done.
Yeah, if you get a test now and you get a test next month or the month after that, whenever things start blossoming a little bit, or your immune system is a little bit better, you're going to get different results because of how your body is. Your body's constantly changing. It's amazing. It's an amazing organism. So that's the problem you run into a lot of times with some of these lab tests. Can they be helpful and effective? Yeah, but there's a lot of you can't take it 100%.
No, and once they find it, the point of it is this: then what? There's a way of desensitizing the body, but it's not just a suppression of immunological response. It's about building the underlying immune system that is causing the response to begin with.
Yeah, you have to help the immune system work better. We talk about that a lot on the show, about things that you need to eat, and there's some different herbs you can take, and we'll talk about that whenever we do our presentation. The other thing is you have to do things to prepare, like right now, the wintertime. I mean, we've gone through, tell you what, yesterday was Valentine's Day. What did everybody eat?
Sugar.
Yeah, so that's,
chocolate.
All that stuff is all our immune systems are, I can't say all ours.
Speak for yourself.
Yeah. Maybe you were good. But that causes problems. And then from that point in our office, we have ways through different therapies, acupuncture, stimulation, to help your system calm down with these things as we work to find other allergies and other things that are attacking your immune system, to get rid of those so that your body can start healing itself.
And that's the key. You have to heal. This Wednesday night, the 18th of the month, 7:30 p.m. at the Roselle Center for Healing in Fairfax, Dr. Matt Adams is going to be your host, your presenter. He's going to be talking about springtime allergies, but more importantly, what you can do about them. There's no need to continue the process of being on these wonderful 21st century drugs that you're on that are just kicking your butt and making things worse. It's not okay. Give us a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there, and we're there to help you. That's why we do these things. That's why we do the programs on an ongoing basis. They're for you. Particularly now's the time. Preempt this. You can desensitize. You can do some things if you're willing to step up to the plate. Charles, how can I help you, sir?
Hello.
Yes, sir.
For many years now, I've been having this congestion, and I can hear and feel my heartbeat in my left ear. It's caused me to have to get on medication for anxiety because it comes and goes.
Because it bothers you so much.
Yeah, sometimes I don't notice it, and sometimes it's really bad.
So, you've said a lot of years, Charles, and is it worse at one time of the year or another? Or is it constant?
I can't really tell. I mean, it's just been going on so long.
Okay.
I've been to 4 or 5 doctors, and they prescribed me antihistamine.
Of course they did.
Stuff like that doesn't work.
Of course it doesn't. So let me give you a little quick insight, Charles. Here's the deal. The fact that it's one-sided and it's not bilateral, and it's affecting your ear and you can hear your heartbeat inside, it tells me that it can be a mechanical problem where the vertebrae in the upper portion of your neck have moved out of position and causing the eustachian tube, the tube that goes from your ear into your throat, not to drain properly on that side. And you're going to see that you're going to have more and more congestion and more and more problems with that side opposed to the other one because of it. You'll get a sore throat on that side. Your ear will be painful on that side. You can even get pressure headaches on that side. But the fact that it's not affecting both sides, it's not into the sinuses, tells me that it's more than likely a localized problem where the vertebrae, in chiropractic, we call it subluxation. Osteopaths call it a spinal lesion. It can be a muscle strain, but more importantly, it's causing an irritation and a drainage problem. But here's the thing where the throbbing comes in. You have blood vessels that go through the bones of your neck. It's called the vertebral artery, and it comes together at the base of the head, and it supplies the circulation to the back portion of the brain. So if those vertebrae are misaligned in a way, it can cause a stretching effect, a narrowing effect, so you hear the blood pumping, you hear the blood throbbing, and it's not something that's going to cause you a stroke or anything like that, but in fact it is annoying, and it can cause congestion, and your ear can hurt, and you can have problems of that nature. But it can be fixed. You can get this thing taken care of. It's not something that you have to live with, but medication is not going to do that at all. My guest in studio, Dr. Matthew Adams, your host this Wednesday evening. It's going to be talking about springtime allergens, and you need to give us a call at 703-698-7117 and reserve your seat and tell my staff you'd like to be there, because I promise you there's a way of getting around this loop, this line that's been eating you for a long time. Dr. Matt, let's talk a little bit more about the diagnostic testing and why the inaccuracy rates exist. But I'll tell you what, one that actually, this really doesn't have to do with springtime allergens, but other allergens is ELISA LRA. That's a phenomenal test.
Yeah. Well, yeah, that one is more specific, and there's a lot of there's a long list of things you have to do leading up to it, and certain facilities that can do it. Because it is super sensitive when it's testing for those IgG antibodies and IgA and IgE, I believe, all three of them. So it's getting very, very specific and more accurate, in my opinion. If you're going to get a blood test, that's the way you're going to go. That's the best way to get one.
Well, the important thing with the ELISA test is to understand that it's a very different type of test. What it looks at is actually the immunological delayed response of the white blood cell. And so subsequently, when you have a reaction, you want to see if it's an immediate reaction or if it's a delayed response. In many cases, it's delayed response. So what they do is they take the white blood cell and they expose it to the antigen, and they watch how fast it reacts or what the surrounding reactive pattern is going to be. So if you're going, the problem is with that test, it's expensive, but there's other ways of doing it. There's ways of determining allergen testing through neuromuscle function response. There's ways of monitoring pulse points to do that's called COCA response, COCA pulse point responsing. By the way, all of this stuff that we're talking about today, there's a chapter in my book, Ageless Health, Health is a Do-It-Yourself program, that all this stuff is in. So go online and pick it up or call our office, and we'll get you a copy. But you can get a little bit more reference, and there's ways of following that through. Marie, how can we help you?
Interesting, very, very interesting topic today. Thank you. I wanted to know, when someone coughs or sneezes, and for 2 weeks before someone has the flu, I guess they're contagious, how long does the virus actually last on your clothing or in the desk or in the air in the room?
From your clothing, it's gone pretty quickly. It doesn't hang out. I mean, after you've exposed it, the viral pattern, midday you're done. And you have to have mucus. You have to have moisture. To keep that virus going and keep it viable.
That's what I was thinking of. When you go to buy fruits and vegetables, they're not covered, and you have thousands of people there. They could be coughing or sneezing. How long would it last on those things that you buy, organic or not?
Just make sure you wash them before you eat them. Go home and wash your hands. When you put them in the refrigerator, then you take them out and you wash. You should be fine if you wash your hands before and after you prepare your food and don't touch your mucous membranes with them. You're going to be okay. So it's a matter of environmental safety as far as how you handle certain things. Is there a problem? Yes. Here's the thing. You go into stores, whether you go into Whole Foods or Mom's, but everybody's got these antibacterial things that you're using, but they're antibacterial. They're not antiviral. And, and besides that, pretty soon now we're developing resistant bacterial bugs that no longer are affected by these other things. So if you keep your hands away from your nose while you're shopping, if you make sure that you're taking things that support your immune system, vitamin C and echinacea and zinc through the wintertime in very high levels, you're going to have a much greater leg up on protective patterns of your body and stimulating your immune system. So, if you're going in and, you grab a hold of something and then you wipe your nose and you're doing...
Or even your eyes.
Yeah. You're going to have a greater response. So there's a common sense pattern about this. So you go in, wash your hands. Hot water all by itself is enough to get this stuff off as long as you do it the right way. So if you do that, Marie, I think you'll find that you don't have to worry about it. But the short end answer is the viruses that you respond to are there all the time. They're there in the summertime. They're in the springtime. They're there in the fall. It's just that your immune system is much lower this time of the year because of all the wonderful things you ate over the holidays, the lack of sunshine, the hot and cold stresses, that we go through, and your body's constantly fighting other people who have very high levels of viral whatever. So wash your hands. Don't eat your food without washing them completely. And besides that, when you're cooking things, for the most part, you're getting rid of stuff. So, Marie, I hope that helps you a little bit. I wouldn't be too concerned as long as your hygiene is, really what it needs to be. We're coming up to a break, and we still have several more of you online. And this coming Wednesday evening, the 18th of the month, Dr. Matthew Adams will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about springtime allergens and, more importantly, what you can do about it so you don't have to continue the slings and arrows of suffering with them. Don't go away. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. We've been at 888-630-9625. That's how you find us every Sunday here at 12 noon, waiting to take your questions and answering them in the right way so you can actually get off of the medications. In studio, Dr. Matthew Adams will be your host, your presenter, this Wednesday evening, the 18th, at the Roselle Center for Healing. And you know what? If you're on Claritin and Zyrtec and Flonase and all those other nose dope things, Afrin, they still use that garbage, Mucinex. This is an opportunity. You want to get through the spring feeling decent, or better yet, would you like to finally figure out how to increase your immunological response? Give us a call at 703-698-7117. That's 703-698-7117. Tell my staff you want to be there, and let's, see what we can do about making sure that your body has the best opportunity to turn things around, and getting off these things. I want to touch on something. We have a couple more callers. We're going to try to take another one. But you talked a little bit about mast cells and their reaction. People say, what's a mast cell?
Yeah, we think we talked about that off the air. The mast cells are the ones that kick in, and that's what causes that super reaction where you swell up. That's where the histamine's coming from. The mast cells are signaling histamine to be produced. And histamine is the thing that makes us get all watery and sneezy and coughy and all that.
The only reason I brought that up is because that's what all the medications are designed to suppress, that reaction.
Yeah.
So you don't go into that type of situation. Bernice, how can we help you? Thank you for listening.
I have a question. question about when you, like, I have a friend whose mother was hit by a door and the wind was pushed the door and then she fell and hit her head. And this was like 7 years ago, and she learned to walk again. She's doing real good. But now she's kind of repeating things, you know, like she'll call her twice a day instead of repeat the same thing. So my mother fell and hit her head and in the front, and her whole face was black about 5-6 years ago, and she ended up getting Alzheimer's. So I was wondering, what can you do to prevent these, Alzheimer's after you fall and hit your head?
Okay, listen up, and we'll go through the process. Bernice, thank you for your call. Alzheimer's is one of those things that we're seeing more and more people being identified with. Is it really an Alzheimer's problem, or is it something else? Well, we have senile dementia, we have Alzheimer's, we have a lot of different cognitive dysfunction that has to do with an area that we mentioned upon today but really didn't take it into the neurological pathway. It's called mitochondrial degradation. And what that means is these little energy packs are being beat up, and we see that with people who have these predispositions will end up with Alzheimer's and Parkinson's and MS and the like. So, and when you have a traumatic pattern, the thought process is that it causes an inflammatory reaction that causes the covering, the protective coat around the cord and around the brain to begin to break down. Subsequently, you have to do a lot of things. One, you need to see somebody in that area. You're out in Arizona that does the kind of work that we do, so you can look at the nutritional pathways, the omega-3, 6, 9 balances, the B12 levels, the substances that are in coconut oil and so forth. But more importantly, making sure that that pain pattern is modified so we don't have an ongoing process. We're going to do a program on that, you know?
Yeah, that'll be good.
It's something that we need to do. But let's talk about your program. We've got a minute before we have to say goodbye to everybody. Tell our listeners why they need to be there.
Well, I want to talk about stuff that people want to hear. I want to talk about what's building up, leading to us to have allergies, and what we can do at home, and what things I like to do, and if you need extra support, what things can be done from a practitioner point of view. We'll talk a little bit about symptoms, but everybody knows what symptoms are. So I want to go, what is it? What's happening? Why is it coming? And what do we do about it? That's what everybody wants to know, right?
That's the most important thing. Yeah, what can you do about it? It's time to get off of these medications. You know what? Your body wasn't designed to have an ongoing pharmacy put into its body, because the truth of it is your body is its own pharmacy. It produces everything that it will ever need, no matter what the condition is. It's only when you suppress it because of structural, chemical, emotional things. Anyway, we'll see you this Wednesday evening, 7:30. Give our office a call. See you next week, same time, same place. This is Dr. Tom Roselle.
Thank you.